An uptick in COVID-19 cases following the expiration of Arizona's stay-at-home order.
Something very different is happening in Arizona, and we need to respond to it urgently.
A first responder describes working on the pandemic's front lines in a hotspot.
I've never really been scared to do my job before, I think until this.
And libraries reopen with new precautions and limited access.
We don't want to be a vector for an increase in cases.
Hello and welcome to Arizona 360. I'm Tony Paniagua, filling in for Lorraine Rivera. Thanks for joining us. Nearly a month since Arizona's stay-at-home order expired, cases of COVID-19 have continued to climb, resulting in headlines warning that Arizona is experiencing a surge. For context, we reached out to Dr. Joe Gerald, a University of Arizona researcher who has analyzed the numbers.
So if you had asked me 3 or 4 weeks ago, Arizona was in a little bit of a better position. Our cases looked like they had plateaued, and in some communities were even declining. But most recently, cases have picked back up again, and it appears to be a very different trajectory. Viral spread is moving faster. These effects are showing up in our hospitals and ICUs, and I think it's time to raise the alarm and say something very different is happening in Arizona, and we need to respond to it urgently to prevent a crisis that might unfold if we don't.
In the past, we've heard, well, we're seeing higher numbers because there's more testing and those are coming out positive. But now it is probably the fact that it is being spread because more people are going outside.
Yes, I think the preponderance of evidence suggests that's the case. There was a testing blitz that ended about 2 weeks ago in which Arizona increased its testing capacity 3 or 4-fold. And so it was a big win for Arizona to get more testing because we needed it. But it did confuse the picture there for several weeks. The last 2 weeks have been relatively flat with regard to testing, yet the number of cases being identified has gone up, and it's gone up fairly quickly. And so it seems to be different from a testing effect. This appears to be real, and that community transmission is on the rise.
We've all heard about the probability of a, quote, second wave sometime this fall. Do you think it's something that's already happening in some places, including the state of Arizona?
I do. It's here. A second wave is here. We never actually really fully recovered from the first one. We more or less hit the pause button. Things didn't get appreciably worse, but now they are. And so I think some of it represents quarantine fatigue. I think Arizonans got tired of staying at home, and there's evidence that they were getting out and about more frequently in mid and late April. Then, of course, Governor Ducey relaxed his stay-at-home order beginning May 4th, and then it was rescinded in May 16th. And so I think combined quarantine fatigue plus less social distancing restrictions have basically fueled the fire that we're seeing now, and they are the proximate causes of increased transmission today.
How widespread is this virus approximately in Pima County or the Tucson area? In other words, what percentage of people are testing positive for those who are getting tested?
Yeah, and so right now I would call community transmission widespread, meaning that literally the virus is everywhere. Maybe somewhere between 1 in 250, 1 in 400 Arizonans are currently infected with the virus and are at risk to transmitting it to someone else. But Arizona is not a homogeneous state, and so the risks vary depending on where you live. And so right now, northern Arizona with the Native American nations, that's been a hot spot for some time where many more individuals are infected, and the risk is much higher. Yuma, Arizona is another place that's shown up most recently as having trouble. And then, of course, our large urban areas like Maricopa County and Pima County are struggling as well. And so there's nowhere to escape the virus, but some locations are doing worse than others.
Should we assume that anybody we encounter could possibly be positive for the COVID-19 virus?
Absolutely. That's it's the only sane way and rational way to approach this. And the reason for that is so much of the transmission is occurring in people who have no symptoms, or at least no symptoms yet. And so there was a recent debate about something the World Health Organization said in trying to say how much of the spread was due to asymptomatic people. And so my understanding really is that The largest risk is from people who have become infected, but they don't yet know it. And so, but they're going to develop symptoms. And so we call these individuals pre-symptomatic. And a lot of transmission occurs during that window, and less seems to occur after you know you have the disease and you might be, oh, I'm not feeling well. Maybe I need to stay at home or take other precautions. And so there's no way to reliably look at someone and go, oh, I should stay away from them because they look sick or they act sick. This virus, it doesn't work that way. We have to assume everyone poses a risk to us, unfortunately.
And what would you recommend to the average person who may be listening to you, watching you right now?
Yeah, and so for the individual, think about their risk profile and how serious it might be if they were to contract the virus. And so those who are over the age of 60 for sure, but also those with health conditions, chronic health conditions like high blood pressure, diabetes, respiratory disease. Right now, they really need to shelter in place. They need to limit their contact with others, including family members, because it's difficult to know who might be infected at any given time, and they're at the risk of the worst consequences of being hospitalized, intubated, and ultimately dying. And so for those Arizonans, they should take action now to maintain their isolation. I think more broadly speaking, for the rest of us who aren't at risk, mask wearing has to be at the top of our list of things to do. It's not so much to protect ourselves, but rather to protect our fellow citizens, our neighbors, our colleagues, our coworkers, by reducing the amount of virus we might be shedding when we're speaking and having a conversation. And of course, doing all the other things that have been recommended, good hand hygiene, maintaining some physical separation, avoiding crowds of 10 or more. These are all things that we can do as individuals to not only help protect ourselves, but help protect those around us.
Well, thank you and all of your colleagues and all your students for your work, and good luck to you.
Thank you very much. I appreciate your time.
With the increasing number of COVID-19 cases, hospitals throughout the state are also raising concerns. Christopher Conover has more.
Today in Tucson and Phoenix, I met with chief medical officers and other leaders from Arizona's hospitals.
In March, Governor Doug Ducey ordered hospitals to be ready to increase their capacity by 25% in case there was a surge in COVID-19 cases. Last week, Banner Health Systems announced it is nearing capacity for its ICU beds statewide.
Over the last period of approximately 10 to 14 days, we have seen an increase in the number of confirmed cases across the state, as you've mentioned, but also here locally in Pima County in the Tucson area. That is translating into increased demand for healthcare services at our facilities.
The spike in cases is not concerning Governor Ducey. During his weekly briefing, he said the surge was expected.
We know to the bed where we are in the state of Arizona. ICU beds in mid-March, 1,532. Today, 1,657, plus 600 additional surge beds that would be available as needed. And today, they are not needed.
Last month, when the CDC released its guidelines for lifting stay-at-home orders, it said one of the criteria to go to Phase 1, where Arizona currently is to have no more than 80% of hospital and ICU beds filled for more than 5 days. Arizona, for the last 2 weeks, has been hovering on both sides of that mark.
Arizona hospitals are increasingly constrained in terms of resources in the increase in COVID positive patients, both in the ICU and inpatients. This is the 6th day in a row that we've seen numbers for inpatients at 1,200 COVID positive patients statewide, whereas for a good part of May, it was maybe in the 600 patient range.
The CDC also defines a rebound in cases as when the 3-day average of cases shows an increase for 5 days. Arizona's cases are rising, which means more hospitalizations.
Hospitals are not a limitless resource. It is limited. And we need to make sure that we contain the spread of COVID-19 in our communities.
When Banner announced it is reaching capacity for COVID patients, one of the issues is ventilators. In particular, Banner is running out of what are known as ECMO units.
It uses a cannula that is inserted into a large vein of the patient. It removes the blood that is deoxygenated, and it uses pumps to remove that deoxygenated blood and then to pass the blood through a membrane oxygenator that basically uses an artificial lung that's outside of the body to put more oxygen into the blood. And then it again uses a pump to pump that reoxygenated blood back into the body.
When hospitals reach their capacity for COVID patients, they are supposed to call a state hotline to help find available beds. That's happening in Tucson.
We do load leveling in the Tucson market between our two facilities, the South Campus and the Tucson campus. We're able to share and pool resources to maximize our ability to care for our community.
The CDC guidelines also say that hospitals should have enough coronavirus tests for their own staff. That too is becoming a problem in Arizona.
Hospitals need adequate testing supplies. I've heard shortages of swabs, reagents, medium that you store the sample in, and then delay in laboratory testing so that hospitals are waiting, 2, 3, 4 days to get a laboratory result in order to discharge a patient safely. And if you're unable to discharge patients, you begin to take up that very crucial capacity in the system.
The coronavirus pandemic does not show any signs of letting up in Arizona soon. Hospital officials are worried not only about capacity, but also about staff burnout, something there's no federal guidance for.
That was Christopher Conover reporting. Both Dr. Carr and Anne-Marie Almaden emphasized that it is up to communities to wear masks, socially distance, and limit time in public to help ensure hospitals are not overwhelmed with COVID-19 cases. We learned about the challenges healthcare workers face from Alex De Leon, an emergency medical technician with nearly a decade on the job in Tucson. De Leon recently returned from assisting first responders in New Jersey. With more than 165,000 cases, it is one of the nation's hotspots for the disease.
I'm on the ERT, which is an emergency response team. You can sign up for it, and if there's any kind of natural disaster, hurricane or flood or something, then they will put together a team and send them out to that location. And I had never been deployed before. And so, this COVID-19 thing hit, and lo and behold, you're going to New Jersey. First, I was in the parking lot of MetLife Stadium for a while. We were sitting there waiting for our orders, exactly where we would be stationed. So this is the place here. This is where I've been stationed. This is Elizabeth, New Jersey, south of Newark. I've been told that this is actually not a fire station. It's a school, a high school, that's been sort of taken over by the fire department.
So we can imagine the physical labor that goes into being an EMT, but what about the emotional or the psychological, especially when you're going into these areas where many people are potentially infected with the coronavirus?
Yeah, it is physically demanding, but beyond that, especially in New Jersey, I've never really been scared to do my job before. I think until this. It felt like the city of Elizabeth itself was sick. I don't know how else to put it, but there's just this thing in the air, this creeping presence in the community that was just, I don't know, creepy is the only word I can think of. There was one thing which I just had to tell you about, which was, we've got our station, which is the high school, and we've got our ambulances parked along one side, and the Trinitas Hospital is right next to it. So the hospital is right there. So we park our ambulances along this alleyway, and there's a fence and the hospital. Well, right on the other side of that fence is a refrigeration truck with bodies in it because the morgue at Trinitas has overflowed. And so they have this refrigeration truck right there. So every time we'd have to run a call, we would get in our ambulance with the truck right there. You know, every time we run on a call, you go by that truck, and it definitely keeps things in perspective. You know, a lot of our calls are not necessarily serious, but you see that, and you know that you're there for a very serious reason, you know, and you should take it seriously.
You saw a lot of the impact in New Jersey, and we hear from people here in Arizona, well, it's not that bad, and I don't really have too much to worry about.
Yeah. Well, I think people have a tendency to sort of not take seriously something that hasn't affected them personally, you know, whether it be a virus or any other thing. Overall, I mean, if I had to give any kind of advice, I'd say listen to the scientists.
Alex, I would imagine there were some light moments in New Jersey. You had never been there before. What was that all like?
Yeah, it was really cool being around people from all over the country, because the way that deployment worked is they were called from everywhere. I mean, all corners of the U.S. There was a lot of interesting food out there. I didn't realize, but it was this very like vibrant immigrant community out there. And so there was all kinds of different kinds of cuisine, amazing Italian food.
Are you going to write a book? Are you going to do something to record this moment in your life, this very important chapter?
You know, I had a journal that I wrote in just on the advice of some friends. You know, they said, write about it, document it, you'll read it later. And I've gone back and I've read some of the entries, and some of them are a little heavy. I didn't realize maybe how emotional I was when I wrote it, but I could probably fill a book.
Do you think moving forward you'd be willing to do another tour like this?
You know, I've thought about that a lot, because there is a very real possibility that it could happen again. So I was raring to go the first time. You know, I was apprehensive, but I really wanted to go out there. Again, it's dangerous, you know, and I have more to think about than just myself. I've got kids, I've got a family, you know, it's not just about me. And it's stressful, you know, just the toll that it takes on you emotionally and physically. It was hard. It's one of the hardest things that I've ever done. So I would definitely have to think about it. I would have to think about going back.
As restrictions related to COVID-19 eased, Pima County's libraries reopened. Branches often provide crucial services within neighborhoods. We learned how they're meeting those demands while guarding against the coronavirus. The Pima County Library System is a collection of 26 branches that serves a population of more than 1 million people.
Wi-Fi sessions, we usually have about 38,000 a week. We usually have about 370,000 checkouts in a month, and that works out to about 92,000 a week.
But that changed during the months the pandemic forced the buildings to shut down, stranding in-person visitors who relied on their services.
We closed the libraries to the public on March 18th, and we were able to open again on May 18th, so 2 full months. And it was very challenging for our staff, because we're so used to being the place where people can come when they need help with anything, and being that safe place for people who are our most vulnerable in the community. But we realized that we also could be harmful to those most vulnerable people by how many people come into the library on any given day.
Like so many establishments around the world, Pima County's libraries are reeling from the impact of the coronavirus pandemic and trying to adapt to a new reality. Safety measures include waiting outside to use a computer and sticking to a 30-minute time limit if others are in line. Visitors also get their temperatures checked when entering the building, and they need to wear a mask. Amber Matthewson has worked for the system for nearly 30 years. She became its director in 2017.
I can honestly say these last 2 months are the hardest I've worked in my entire life. Many days from 7 a.m. to 7 p.m. Just because of all the different policy changes and working through how we're going to manage. And as you might imagine, having 26 libraries, closing them down took a bit of effort, but starting them back up has been more daunting than I would have thought. It's not easy to get those gears rolling as smoothly, especially with all the things we need to put into place.
It's not like flipping on a light switch.
Exactly. Yeah, and books kept coming. The books we had on order kept coming in during all that time, and so there were a lot of things that had to stay in motion.
Since opening last month, the library has let a limited number of people inside, but now prohibits browsing in person or lounging inside. Administrators admit that some residents have complained about the changes, but Mathewson says she has to act cautiously.
I just want everyone to know that we don't want to be a vector for an increase in cases in the community. And so we want to take a very metered role in getting people back into the libraries. We also have everyone in the community. So we have the very elderly, the very young that come into libraries. And so it's a little bit different than some of the other things that are opening up around town. Going to a salon and all of that. It's mostly adults. They're different standards, but we want to be very careful that we're not the reason that more people get sick.
Computers are pivotal in this safety effort, with more online traffic taking the place of traditional walk-ins. One program that illustrates this is a cooperative effort between Sunnyside Unified School District, Pima County Library, and a digital student reading app called Sora. The collaboration began just before the pandemic also forced schools to close.
This is a new partnership that just started late February, early March, and it involves ebooks, audio, and ones that you would read on the screen of your phone or your tablet. And there's the company that has the ebooks is called Overdrive, and so they said that this was a possible partnership for us, and that our students would be able to have access to both library collections. And it actually allows the students to have access to the collection with their student ID. So instead of getting a Pima County library card, they use their student ID, their number, and their username, and then they can log in. Another good reason to have the ebooks is because our capital budget, which allows for paper books, has been really actually taken completely away for many years. When I first became a librarian, I noticed that we weren't able to buy any books. The Sora app, it downloads automatically the content, so you don't even have to go through the extra step of being able to figure out how to download it into your Google browser. It does it automatically. And so when the students are in the physical building of the school and they check out the book is downloaded to their laptop. And so then if they're in the car or they're waiting in the doctor's office or they're at their Nana's house and Nana doesn't have internet, then they can still read their book.
And that remains a major goal for this organization. Reading opens up new worlds, and libraries are often the launching pads for that exploration.
The shelves are pretty full, but the reserve lists the reserves are flying off the shelf right now. So we're excited that people are back to books. And I had walked down here a few weeks ago before we had opened, and I was just walking among the stacks, and it made me really sad because Ranganathan, who's considered the father of modern libraries, two of his rules were every book its reader and every reader its book, and I just felt like our books didn't have their readers. So we're glad to welcome everyone back, even in a limited way. I know this is really different, and they really look to the library as a great place to go and learn and seek and relax. And we will get there again, and we're waiting for them to be right there with us when we're ready to do that.
Limitations imposed by libraries speak to a side effect of the pandemic's impact in southern Arizona. As temperatures rise, areas where the public could go to cool off are less accessible, especially spaces that have traditionally served the homeless. But resources are expanding, as we learned from Liz Morales, director of the City of Tucson's Housing and Community Development Department.
Every year we work on what we call cooling centers. And this year, as we're asking agencies and different places, many of them were unable to do what they've done in the past, except for the Salvation Army. The Salvation Army did launch their Operation Chill Out, which provides outdoor relief at their sites and community parks when the temperatures exceed 102 degrees. What they do there is they'll provide water and other supplies like sunscreen and hats and chapstick. So we approached the Salvation Army and asked them, since you're already doing Operation Chill Out, would you look at expanding
Morales says the city and the Salvation Army hope they can roll out additional services in a few weeks, mainly indoor relief at the Salvation Army's 3 locations that can serve up to 150 people a day. They will also offer meals, showers, and transportation from parks to its cooling centers. Safety protocols will be implemented to include regular cleaning and social distancing.
And so we're very grateful for the Salvation Army for their willingness to do this and working with the city. Because we have these CARES Act funds, we know we can help support that expansion of their Operation Chill Out.
Any idea on the number of people that have traditionally sought assistance during the hot summer months?
Well, we know that at any point in time, we could have about 4,000 people based on past point in time counts of homeless. As far as people who actually access, I don't know how many actually access these indoor kind of relief centers, but we do want to build as much capacity and make sure people are aware of what's available.
You mentioned that your department handles Section 8 assistance for rent and finding homes for needy residents. Has there been a surge in people seeking assistance right now because of the COVID-19 situation?
I would absolutely say yes. I couldn't give you any hard numbers as to how much, but just based on my own emails and phone calls, and I think people are reaching out in every possible place. And then I think there's a lot of people who aren't reaching out, who don't know where to go. So, my concern isn't so much the surge of calls, but also the surge of people who are in this situation. They've never been in this situation. So we know the need is there just based on looking at what unemployment numbers are. We know that's impacting families and their ability to pay their regular bills.
Morales says her department is working with Pima County on a program that uses CARES Act funds to help residents cover rent, mortgage payments, and utility bills. CARES Act dollars will also continue to bolster its efforts to assist the city's homeless.
And we do know that the heat's here, and we're all accustomed to living in Arizona, but none of us are accustomed to living on the streets. So we definitely want to provide whatever we can to protect people, so we can avoid any deaths as a result of the heat. So that's really the purpose.
All right, Liz Morales, thank you very much for your time.
Thank you.
That's all for now, and thank you for joining us. To get in touch, visit us on social media or send an email to Arizona360@azpm.org and let us know what you think. We'll see you next week.